Welcome to the Girl Doc Survival Guide. I'm really excited to be joined by Dr. Tessa Davis, a pediatric emergency medicine consultant at the Royal London Hospital and a senior lecturer at Queen Mary University of London. Tessa's had a fascinating training journey, including 4 years in Sydney, and she's now leading one of the most respected pediatric emergency programs in the United Kingdom. She's also the co-founder of Don't Forget the Bubbles, a global resource that's transformed pediatric education. Online, Tessa shares practical tips from nailing medical interviews to improving public speaking and using tech more effectively. With over 130,000 followers, in today's conversation, we'll talk about what it takes to thrive in pediatrics, how she supports other doctors in high-pressure moments, and how she manages all of this while raising 3 kids and 2 dogs. Welcome, Tessa.
Thanks for having me.
Could you share a personal anecdote about yourself?
We lived in Sydney for 6 years, which was fab. I'm from Glasgow. When I was pregnant with my youngest child, we moved to Sydney. We lived right by Bondi Beach and it was absolutely beautiful. But it was very far away from family in the UK, so we moved back.
Why did you move there?
To just experience work elsewhere. It's a great place for family life. It's a great place for work-life balance. It was wonderful.
Why do you think it's better there for work-life balance?
The culture is very focused on enjoying life. I think the weather does help. Beautiful weather. Everyone appreciates the outdoors, enjoying the sunshine. The culture is also when you work more there, you get paid more. It's slightly different culture where you can step up to take more on, but you get rewarded. It makes it a more balanced process for everyone. You can make your own decisions about how much you want to work and how much you want to wander on the beach.
How did you come to start Don't Forget the Bubbles?
Don't Forget the Bubbles started when I was in Sydney, 2013. It was a time when there was starting to be online blogs, this movement of free open access medical education. There were a lot of emergency medicine blogs, but there wasn't a pediatric one. There was starting to be medical Twitter. I was starting to get the hang of social media and thought it would be a good idea to start a peds blog. I sent out a tweet saying, does anyone fancy starting a pediatric blog? There was a lot of tumbleweed. And then 3 people replied. I didn't know them, but we decided that's who we've got. We got together and set up a blog, Don't Forget the Bubbles. We put a lot of work in and we spent 6 months writing lots of posts. So we had 100 posts ready to go before we started. We had a plan for the first 3 months. We launched it where it was just a blog. It was just to give free education. But over the 10, 13 years, it's grown into a community where we run events each year. There's YouTube videos, podcasts. So it's really grown beyond what we initially thought. And it's been fabulous.
Nice. So it just grew from there.
It just happened. We didn't go with an intention of doing anything, but we were persistent. It was just the 4 of us at the beginning, probably for the first 5 years. And then we realized we can't keep doing it by ourselves. So we started to think about how we could bring in other people and involve other people, which is hard because when it's your thing, everyone used to think of it as being the 4 of us. We knew that wasn't sustainable. So we worked hard to bring in other teams and now we've got amazing people doing it. It also needed to be financially sustainable as well because writing a blog with 4 people is fine. But when you've got 1.5 million views a year on the website now, there's costs that come with that. Editing, hosting, all of the things that come with it. And that's part of the challenge with free open access medical education. It's free for the user, but it's not free for the creators. So then we started doing some online courses, which people pay for. It's run as a not-for-profit, but it means that we can sustain ourselves and still run the things that we want to run for the community, like the conference, which doesn't make us money, but is a community event where everyone can get together face-to-face and really have this amazing connection for a few days each year. And it's really special.
How would you find people?
The best way that I find people in the teams I work is when you work with someone and it feels right. You just feel like they work the same way you do. You have a laugh. It has to be enjoyable. None of this is for financial gain, so it has to be enjoyable. When we find these people in every team, I really try and hang on to them and work out what they want, how to use their skills. That's how we did it. And over time, we just attracted more excellent people and it's worked out really well.
How much time would you say you spend right now on Don't Forget the Bubbles?
Right now, it's not a large amount of my time. I'm mostly involved in running the conference, and then we make strategic decisions.
So you mainly work in pediatrics emergency.
I have 3 main roles. I work in pediatric emergency in a trauma centre in London. I run the master's programme in pediatric emergency medicine at Queen Mary. That's an online master's. And then I do interview coaching for doctors in the UK, prepping for their senior job interviews. My week is split between these 3 things and some Don't Forget the Bubbles. It's a good balance.
How did you get into coaching people for these high stakes interviews?
I was applying for jobs in pediatric training in the UK. I thought it would be fine. I was young. I just thought I want to do pediatric training, so I'm going to do pediatric training. I'll just do the interview and it'll be fine. But when I went for the interview, I was terrible. I was really terrible. I didn't know how to interview. I didn't know what to expect. It was a disaster. And I couldn't get onto a pediatric training post for a number of years. It wasn't just like a one-off. I was really bad. Eventually, I did get onto one, but I always carried this weight. If you've ever been knocked back from a job interview, it really knocks your confidence. I carried this with me that I'm a terrible interviewee. And it was true. It wasn't just in my head, it was true. And when I got to the other end of my training, I needed to get a consultant job. I knew the job I wanted. This was it. In the UK, the job might come up once every 5 years or something. If you don't get it, that could be the job gone. And potentially you might have to move somewhere else in the country. So I just really wanted to do well. So I essentially worked out what the panel were looking for, how to streamline my prep. And it was a combination of what I knew from the education experience I'd done at Don't Forget the Bubbles. And then when I was able to work out how to optimize my time to prep in the right way and not waste time going down rabbit holes of the wrong things and just really focus on how to score points in the interview. Then I was able to help other people do that on a one-to-one basis. I brought together my community building skills from Don't Forget the Bubbles and my online masters into something fun, the community for people and good online education. And so that's what I do with my interview prep. I love helping other people because they're all experiencing the same things that I've been through. And I know what it feels like, and it feels scary and bad when you get negative feedback. So I really enjoy that aspect of my work.
Definitely when I was younger and looking for jobs and things like that, I had a number of interviews for fellowships and different training opportunities. With what you've learned through your own experiences and through coaching, what do you think are some common traps that people fall into when they're preparing for an important interview?
The first common trap people fall into is thinking that there's someone else who's the favorite for the job. I've got no chance of getting this job. And it's something we tell ourselves to protect ourselves. It doesn't help your performance because you go in thinking you're not going to get it. And that comes across in your performance. I see people who talk themselves out of jobs before they even get in the door. And even though it seems like a fluffy thing, the mindset is really important because if you can go in believing I'm ready for this, I'm going to do my best, it's a level playing field and I'm going to do my best to smash it on the day. That's very different from this isn't for me, I'll just go in and have a practice and it's not going to be mine. And so that's a very common thing. Although there might be someone who looks better on paper, in the end, the interview process is not a perfect process. Realistically, you're not finding who is the best clinician or anything like that. It's literally just who can score the most points on the day. Whether that's fair or not, probably not the best way, but it's the way that we've got. And if you can perform better on the day, then it makes a massive difference. It's confidence. And I love seeing people build their confidence. That comes with practice, with understanding what they're looking for and what they're going to ask you.
So what else do you think helps people when they're preparing for an interview?
Saying it out loud definitely helps. Another thing I see very commonly is a nervousness about practicing out loud, which I understand why, because if you're not used to it, it's awkward, it feels weird, you don't want to do it. People often just write stuff down. You could look through 100 interview questions and write down all your very good points or think about them in your head. But in reality, it doesn't sound the same when you say it out loud for the first time. And what you don't want to do is all that writing, reading, all that sensible stuff. But then the first time you say it out loud is in your actual interview because you're going to be so nervous because it's a big deal. And of course, you're going to be nervous. So it's just not going to come out well. That process of saying it out loud helps you realize where you're going wrong. Is your answer too short? Is it too long? So a lot of what we do is try to push people gently, but give them that nudge to just do it and say it out loud. It's the same as any procedure that you learn. If I think about the first time I put a cannula in a kid, it was terrible. I didn't know what I was doing. My hand was shaking. It was a disaster. But now I'm confident. I'm an expert at it. Doesn't mean I always get it, but I'm an expert at it. And that's not come by reading a lot of textbooks or drawing diagrams of cannulas. It's because I've done it like thousands of times. Practice is really important, like any other skill. We try to just get people to say things out loud in different ways, under pressure in different ways, and that really makes a difference.
I like that a lot because interviewing can just be thought of as a skill. And like any skill, it's not something that we can just turn over in our minds or even write down on a piece of paper. We actually have to practice the skill. And interviews are conducted in general face-to-face, or at least video. Orally, you have to be saying the words aloud. You don't send a piece of paper across the desk to someone.
No one's naturally a great interviewee. For most of us, we don't just stroll into an interview room and give amazing answers. You practice and you learn it. And there's no one who is not able to get up to speed to do well in their interview. When you practice and when you streamline your prep, you can have confidence going and you feel completely different when you walk into the interview room.
Do you think that interview situations are uniquely stressful to women or other groups?
Definitely the part about having to sell yourself is more challenging. We're not used to bragging or having to sell ourselves, and it feels weird. It can be hard for people to be brought out of their shell to do that. What I say to people is, it's an interview. It's a weird situation. You're not having a coffee with someone. You are trying to get them to give you a job. And the only way you're going to get them to give you a job is by scoring more than the other people going up against you. And the only way you're going to do that is by telling the panel what you have to offer. If you go in and you don't know what you're bringing, or you're not sure what you're bringing to the team, the panel won't know either. There's no way. If you don't know, they won't know. It's a performance you're giving for 30, 40 minutes of your interview. You have to come out and sell yourself. And so a lot of what we do with people is help them to identify what it is that they're bringing to the team. People often aren't sure, or commonly people will say to me, I'm just the same as everyone else. I'm just a trainee. I've done the same training as everyone else. There's nothing special about me. But when you recognize what you've done, you're going to showcase that. You feel very differently, not just because you can say it to the panel, but because you feel good about it and you're excited to tell them. So it definitely is an issue of selling yourself. I also find there's a lot of women I have in my academy who are on maternity leave while they're trying to prep for an interview. This can be very challenging because you feel like you're not in the workplace, and so you feel like you're out of touch. And that's a confidence issue. There's no reason why you can't get a job in that situation. It's just building your confidence with the same things I mentioned. You prep, you streamline your prep, you know what you're bringing, what they're looking for. One of the things I love is having women on mat leave come into my academy and being able to turn them around very quickly so that they go in feeling great and get the job.
It's hard to go back to work after maternity leave in general. That does sound challenging. I'm glad you can help coach women in that situation. Segueing to one of your other roles, you're a consultant in pediatric emergency medicine. Do you see certain stressors that you and your colleagues face?
The stressors are probably not unique to pediatric emergency, and it's about the general busyness of the service that we're providing and how to balance that with two things. One is being able to provide a meaningful experience for the trainees that we have with us. And the other is being able to have sustainable careers for ourselves. Because if you're working flat out in a busy emergency department, feeling like you're getting slammed by the busyness all the time and not able to look after yourself, that might be fine for 5 years or 10 years, maybe even 15 years. But in 20 years, is it going to be okay? We want to build sustainable careers for people. So I think these are the biggest challenges, the trainees' experience and our own long-term careers.
With all your experience in coaching, do you have advice for people on how to create a sustainable career?
I wouldn't say I've got the magic solution. I'd be disingenuous. I do think having a portfolio career in the UK where you're doing more than one role, I've tried to have a number of roles and it is busy, but definitely having a balance. I think the people who work full-time clinical work, it can be hard by the time you're in your late 40s, 50s. It can be hard to keep going. So I really think part of the way things are moving in the UK is that people have different roles. You might do part-time clinical and then take on an education role or a management role or a non-clinical role. Having that balance is really important. For me, it is as well. I do 2 shifts a week currently in the emergency department. And the rest of the time I'm doing other roles, which are flexible. Often I can work from home and I can be around when my kids come home from school. Having that balance is important. And I think that's the way that more and more people will be going in medicine.
And so your 2 shifts in the UK, what are they like? What does that mean?
So I'm there 2 days a week. I do shifts of varying lengths. They're not overnight, but can be late into the evening. It's a very busy trauma centre. We're a pediatric major trauma centre. We've got helipads on the roof and retrieval teams bring trauma to us. We also have regular patients walking in or referrals from primary care. It's a very busy unit to work in.
Is it generally 12 hours even, or?
It would be shorter, 8 hours in length.
Okay.
The shift length definitely is good for sustainable careers, particularly as you get older. The reality of very long shifts is probably not realistic from a sustainability point of view. Our shifts are a good length, I think, for being able to come in, be focused for the time you're there, be present, give it your best, and then go home.
Do you have particular methods for stress management before you start a difficult shift or another type of difficult task?
I don't feel stressed when I go in to work, to be honest. I love it. I love working in that environment, which is why I keep doing it and why I want to keep doing it on a regular day. When there are stressful things that happen, the things that I fall back on are my colleagues, having trusted colleagues who I can debrief with and chat to about anything. I think that's why the team is so important, because you need to feel safe when something goes wrong or when you're feeling stressed about something. Maybe you've done something wrong, maybe someone else has. You have someone who's got your back on your team. I'm very lucky to have people on all of my teams that are these people for me. We can go for a cup of coffee, a cup of tea, and have a chat. That honestly is the thing that makes it great. Otherwise, you're floundering on your own. Obviously, I've got my family, I've got my husband, and I can talk to him. But having someone there who understands what's going on in the team that you can talk to, it makes a massive difference.
Yeah, I like that. That's important to have that safety, as you mentioned, to be able to be honest, because in medicine, things are going to be stressful at times. People are sick, sometimes very sick, and it's not always easy to know what is wrong with someone who is very sick. No matter how much experience you have, there are going to be times where you feel like, oh, maybe I should have done this or that, or I could have thought of this or that.
Yeah.
Things.
And I think for the junior team, our trainee doctors, it can feel very isolating for them. When I was a trainee and I made mistakes, it was horrible. It's a horrible feeling and you feel so vulnerable. Having senior people on the team who can be vulnerable themselves, not in an oversharing way, but in a, I've been there, it's okay. In the team that I'm in, we're all very good at saying, this is what's happened to us. We've been in this exact situation, and not it being a, oh my goodness, you've done something terrible. I think that makes a big difference for trainees as well, because you want your resident doctors to feel safe in the environment as well as you feeling safe. That's a very important part in a stressful, high pressure clinical environment.
What you said is true. As a trainee, you do feel very alone when you make a mistake. I think you do later on too. As a trainee, you feel just more, just everything's a little more new. To make a mistake just feels, I think, worse. Definitely helps to know that people who are ahead of you in experience have experienced similar things. It sounds like you've done a great job of creating the career you want, knowing what you want, but also being able to advocate for yourself to get what you want. You called it a portfolio career. Do you have general advice for people on how to know what they want and advocate for themselves?
It's hard to advocate for yourself. For all the reasons we've discussed, you don't want to be pushy, you want to be collegiate, you want to be a good team player. It's balancing your needs versus the needs of the teams you're in and your family. I think it's taking opportunities when they come, even if they're a bit left field, because if you see something that you think it could be good, even if it feels out of your comfort zone, some of them will work, some of them won't. But if you do enough of them, you'll find the things that work. You'll find the teams that you love. And when you find them, you do more of them. And that's what I've tried to do. When I've found the people I like working with, I work with them more. When I find the roles that I love doing, then I do them more. And so you have to be open to it evolving. I don't know how easy it would be to have a 10-year plan and make it happen. Maybe that works for some people. It feels quite stressful, the idea of doing that. So I think it's being flexible, but also knowing when you see something good and how to hold on to that and embed that in part of your work life.
Do you think that's the most important thing in building a career that works for you, to be flexible?
You've got to be flexible within reason because you've still got demands on your life and priorities with your family. I don't think you can be fully flexible, but having an open mind to opportunities, being aware and open to what's out there, not ruling things out immediately. Once you start to think something could be a cool opportunity, give it a go. There's lots of things that I've tried that have not been successful. I just tried a lot of things and some of them worked and some of them didn't. The ones that worked, I went with and did more of them. Usually they were the ones where the teams were best and we all enjoyed ourselves the most, and you make these things a success. So rather than flexibility, maybe that's the wrong word, having an open mind to the possibilities.
I appreciate you sharing all that. So you're saying be flexible within reason. We all have other demands. Keep an open mind and try things. Don't just rule things out because maybe you'll really like it. Recognize that we are all not going to be successful with every single thing that we touch. And there is going to be a failure rate, even for someone successful as you are now. Are those kind of the main things that you think are important then in building a career that works for each individual?
Yeah, I think what I found is that the more I try, then the less stakes there are in things failing. Because sometimes if I talk to people, they don't realize all the stuff I've done that didn't work because it just falls by the wayside. I think failure gets easy. It still hurts, but it gets easier the more you do it. But the other thing to add to that list is finding good people, because the best projects are with the people that I love working with and we all work well together. That's the biggest reason why projects are successful that I've been involved in.
Just now, you mentioned failure, and I think we touched on it briefly earlier. You were talking about how you were not good at interviewing and didn't get the pediatrics position you wanted over several different interview cycles, yet you kept trying. And I think just now you were saying there is an inherent failure rate to trying, putting things out there in the world. And that we need to be able to accept that there is a certain failure rate for every single person. I think sports is the best analogy for that if you're trying to make a soccer goal, not even the best player in the world is going to make 100% of the shots.
Exactly. But in clinical practice, the mistakes are obviously higher stakes. In the clinical world, we're trying to accept that we're all human and we make mistakes. But at the same time, we don't want to make them because they could have significant consequences for our patients, but also for us and the team. But then if you're thinking about the broader career and other projects, then in that sense, failure is a good thing. I don't want it to come across like I brush off failure because I don't. I overthink failure and I spend ages thinking why. But it is part of a learning process. All of these failures have brought something better because you've learned from it and you can move forward. And I'm by no means perfect at that, but that is what I would like to happen in my life. And so I go forward with that in mind.
You bring up a really important point when you say that we are trying to recognize more and more that we are human, even in our clinical work. That is an area where we definitely do not want to fail. And yet, we are still human, so we are going to make mistakes. Going back to your comment on mindset, I think the mindset in medicine is that we do need to be as perfect as possible. At least that's my mindset, and I think you just touched on that as yours as well. So it is hard, maybe harder for a physician to make that shift in non-clinical work to be okay with not accepting perfection.
One thing that I've felt in clinical mistakes in the past is that you fight the mistake in your head to try and explain why.
I used to really berate myself for my mistakes, and I still definitely don't enjoy clinical mistakes that I make, but I am much better at just facing them and looking at it factually. Oh, here's a mistake that I made. Here's an error. And you're right. It does not feel good in any way, but to be able to face it and sit with it and just be like, okay, I made this mistake. And then my next thing isn't so much like, why did I do it? It's more like, why did I do that so I don't make that mistake in the future? Which is just slightly different. And I find that to be actually a helpful process in working through the mistakes I make.
Especially if you're an overthinker, you just keep going around in circles with the same thing, explaining to yourself why you did it and why it was okay. I don't think it's very healthy.
Do you have any final thoughts?
It's actually nice to chat and think through things in this way. We don't get a lot of time just to stop and reflect on these things. I've been working in pediatrics for 25 years. Just to stop and think about how your career develops and how you handle the difficult situations is a really nice thing. More people should do it. We should make more time to do it. So yeah, it's nice talking about it.
I agree. Thank you for your time.
Thanks. It's been great chatting to you.